Eggs have been at the center of nutritional debate for decades, but recent studies are giving them a surprising new role in cardiovascular health, not as a risk, but as a potential ally in lowering triglycerides, especially when paired with a low-carb diet. This might sound counterintuitive to anyone still clinging to the outdated idea that eggs are cholesterol bombs waiting to explode in your arteries. But science, as usual, is evolving, and eggs are once again redefining their role on the breakfast plate. Triglycerides are a type of fat found in the blood, and when levels are high, they're strongly linked to increased risk of heart disease, especially when combined with low HDL cholesterol or insulin resistance. Elevated triglycerides are often driven by high sugar intake, excessive refined carbs, alcohol, and sedentary lifestyle. The good news? They're also highly responsive to dietary change, particularly carbohydrate reduction. This is where eggs come in. Recent studies have shown that incorporating eggs into a low-carbohydrate eating pattern may actually help reduce triglyceride levels significantly. In low-carb or ketogenic diet contexts, where carbohydrates are restricted and fat and protein take center stage, eggs serve as a high-quality, low-carb protein source rich in choline, selenium, and other nutrients that support lipid metabolism. Several small trials and observational studies have found that participants on low-carb diets who consumed eggs regularly saw not only reductions in body weight and waist circumference, but also notable improvements in their blood lipid profiles, including lowered triglycerides. One study published in Nutrition and Metabolism followed overweight participants on a low-carb, egg-inclusive diet and found significant decreases in triglycerides compared to those on higher-carb diets. The likely explanation? Cutting carbs forces the body to shift from burning glucose to burning fat, a metabolic state that can lower triglycerides by reducing the liver's production of very low-density lipoproteins, VLDL, which are rich in triglycerides. Eggs, being carb-free, fit neatly into this shift while offering satiety and essential nutrients. Another aspect to consider is choline, a nutrient abundant in egg yolks that plays a role in lipid transport and metabolism. While its direct effect on triglyceride levels is still under investigation, choline supports liver function and prevents fat accumulation in the liver, which may have downstream benefits for overall lipid balance. It's important to note that these benefits aren't coming from eggs in isolation, but from the synergy between eggs and the broader dietary pattern. In the context of a high-carb, high-sugar Western diet, simply adding eggs won't magically lower triglycerides. But in a lower-carb, whole food-based diet, one that replaces refined grains and sugar with protein, healthy fats, and vegetables, eggs can be an effective and sustainable anchor. Of course, not everyone responds the same way to dietary changes, and people with specific conditions like familial hyperlipidemia or very high baseline triglycerides should work closely with a healthcare provider. But for many people looking to manage triglycerides through diet, the message is shifting. Instead of fearing eggs, we're now seeing how they can be part of the solution, not just for maintaining muscle and curbing appetite, but for directly improving markers of metabolic and cardiovascular health. So yes, eggs may be cracking into a new role, not as a lipid villain, but as a versatile, nutrient-dense food that can help support healthier triglyceride levels when used wisely. Paired with smart carbs, healthy fats, and real food choices, they just might be the quiet hero of the low-carb plate.